knee joint. Knee joint, that is articulatio what? Genus in Latin. Articulatio genus. How many bones participate in this joint? We'll try to count. This is femur. Next, patella and tibia. Fibula not participate. Fibula not participate in knee joint. Fibula and tibia mixed. They makes isolated joint. Articulatio tibio-fibularis. Here it is. But knee joint has 3 bones: femur, tibia, and patella. This joint, that is why this joint is compound joint, because 3 articular surfaces. It is compound. Next, what is the shape of this joint? If it is condyles of femur and condyles of tibia, that is why it is condyloid joint. And condyloid joints are usually biaxial. And this joint has intra-articular meniscus medialis and meniscus lateralis. And this meniscus medialis and lateralis separate this joint into 2 halves. That is why it is complex joint. One again, knee joint, it is compound because consists of 3 articular surfaces. It is condyloid because it has condyloid shape. It is biaxial joint and complex because it has meniscus medialis and lateralis, 2 meniscus present in knee joint. Movements in frontal axis, that is flexion and extension, and in position of flexion, it is possible to make rotation, lateral and medial rotation outside and rotation inside. 2 movements: flexion, extension, and in position of flexion, lateral and medial rotation. Now, ligaments. In knee joint, we have intra and extra articular ligaments. Intra-articular ligaments, here it is, ligamentum cruciatum anterior and ligamentum cruciatum posterior. 2 cruciate ligament, anterior and posterior. And between meniscus medialis and lateralis, we have transverse ligament, ligamentum transversum genus. They are intra-articular ligaments. And extra-articular ligaments, here it is, ligamentum collaterale fibulare. Here it is, ligamentum collaterale tibiale. Ligamentum patella, between apex of patella and tuberositas tibia. And ligamentum popliteum obliquum and ligamentum popliteum arcuatum. It's attached to the head of the fibula. Ligamentum popliteum arcuatum. They are extra-articular ligaments. And last in this joint, that is bursa. Some synovial bursa present between knee joint and nearest muscles or skin. And this bursa decrease friction in joint, or between joint and muscles, or between joint and skin. This synovial bursa, you should know 5 bursa. 1 bursa above of patella. Here it is patella. Here it is quadriceps muscle, that is very large muscle on the thigh. And between tendon of quadriceps and femur, we have bursa, which is above of patella, suprapatellar bursa. Bursa suprapatellaris. Another bursa between ligamentum patella and tibia. Here it is deep bursa below of patella. Bursa infrapatellaris profunda. Below of patella, deep bursa. Bursa infrapatellaris patella. And 3 bursa in front of patella. 1 is below of the skin. Skin in Latin it is cutis. That is why bursa subcutanea prepatellaris. Another bursa below of fascia, bursa fascialis prepatellaris, and last, that is bursa subtendinea prepatellaris. All of them in front of patella. One is below of skin, another below of fascia, and last is below of tendon of quadriceps. That is why subcutaneous, subfascialis, and subtendinal prepatellar bursa. Next.